I got a message that says the meeting is now streaming live on Facebook.
Okay, fantastic. So I'm so sorry. Let's start again. Yeah.
Perfect. So do you want to do an introduction?
Hello, everyone. Well, we started a few minutes ago, but realized we weren't streaming. So if anybody is on this, we hope, or as you join us, this is Dr. Toni Corretto, and we have been fortunate enough to have her as a friend of Stand With Trans for about 5 years. She was one of our very first experts who helped us begin to educate the community about trans issues and transgender children. Today, she's going to talk about being transgender and why therapy is important for everyone, what families can do, how to engage with the right therapist. And so I'm going to turn it over to her. If you have questions, just post them in the Facebook Live. I will grab them, hopefully, if this works, and I will put them in our chat window so Dr. Corretto can see them. And we're just keeping our fingers crossed, round 2. So Toni, you're on.
Okay. So thank you for having me. Given the late start, I'm just going to jump right into what I'm going to talk about today, which is why when your kid comes out as trans, they should get some mental health treatment for the family. How do you find the right therapist? What are you looking for? What might get discussed? Things like that. So when kids come out as transgender, one of the reasons that I think it's helpful for they and families to get into treatment is because this is usually a very new experience for families. This is not something parents have dealt with before. This is not an experience they have any knowledge of. So they need support, and the kids need support to feel not so alone. The second reason that I think it's important for kids and families to get treatment when their youth comes out is that we know that it's common for trans youth to have coexisting mental health disorders. These are often internalized disorders that you don't see symptoms of, maybe more things like anxiety and depression. With older kids, there may be some externalizing, some acting out, some avoidance of school or things like that, but oftentimes there's mental health issues going on as well. It's not that one, that being transgender itself is a mental health problem, but it does often travel with anxiety and depression. And I also think a bit of PTSD. Thirdly, we know that there's a large overlap for some reason between a trans or gender nonconforming identity and autism spectrum disorders. So it would be helpful to get your kid into therapy and see if there is perhaps a previously undiagnosed autism spectrum disorder. That could be immensely helpful for many reasons. And then finally, we know that especially children who were assigned male at birth, if they are expressing gender nonconforming behaviors out in the larger world, they may also be experiencing harassment, stigmatization, ridicule, hatred. So they need support. And your kids may not tell you that this stuff is going on at school or on the sports team. So they may be more willing to tell it to a therapist, especially if I ask or a therapist asks about it. So the ways in which psychotherapy can be helpful for trans youth and their families are numerous. Obviously, the other thing that I didn't mention is that therapy is a place for them to further explore their gender, to really be able to articulate how it is they feel about themselves, their gender identity, the role, the expression, and to kind of get a better grip on things. It also helps that they can address whatever stigma they've had to deal with. Internalized transphobia, for instance, the larger society has certainly given them the message that they are wrong or sick or not normal. And that takes its toll on mental health and physical health. And so being able to unpack some of that in therapy can help them immensely. Therapy can also, because it helps with communication, can help improve their peer and social and family relationships and allow them to access the support that maybe is already there for them, but they just can't make the connection. Furthermore, because therapy is a place where anything can get discussed and there's privacy, they can talk about body issues, issues around sexuality, things that they may not feel comfortable talking with parents or peers about, but can be discussed in a confidential setting. So it can help improve their body image, for instance, and just general resilience to whatever messages they're getting externally and in their own heads. Just in general, I think for both the youth and the families, coming to therapy, coming to support groups is a way to remove the stigma, remove the secrecy, and kind of get some relief from this heavy burden that you feel. So what exactly might a gender therapist do for your family? Well, directly assess the gender issue, get some clarification of what exactly that's all about, provide family counseling and support, both around the issues of gender and any other psychosocial issues that are going on, whether it's a mental health issue or an educational issue, a peer issue. Obviously, if there is a coexisting mental health issue, that can be treated and addressed. Therapists are a great resource in terms of referring out, if needed, to a friendly pediatrician, psychiatrist, support group, endocrinologist. A good gender therapist has those resources. And finally, I think it's the role of a gender therapist also to do things like this, educate and advocate out in the community, not just sit in our little offices with families and individuals one-on-one, but also to help the larger community. So you would want to look for a gender therapist who can do all of those things for you. Specifically, you want to look for a therapist that has a degree and is licensed by the state. You would trust that if they've received licensing, then some of these other points I'm going to make have already been addressed, but you may want to inquire also, are they competent and comfortable in using diagnostic manuals like the DSM? Because if there is something else going on, they need to be trained well enough to know and to spot it and say, hey, wait, what about this other thing that your kid's talking about that maybe needs attention? They should have training in child and adolescent development. They should be, as I said, competent in being able to diagnose issues that children and adolescents typically experience. They should also be familiar and comfortable and competent in addressing issues around gender dysphoria in general among, adults, children, and have familiarity with variations of gender expression and concepts. You don't want to be educating the therapist about what something means. You want someone who already has that information. And you should have a gender therapist that is always getting continuing education around these issues. Bonus points would go, I think, to a therapist who is a member of WPATH, which is the World Professional Association for Transgender Health. WPATH does a lot of education. They have conferences every 2 years. They publish a journal of transgender health that goes to all of their members. They have listservs online. It's a very great resource for gender therapists if they are a member of WPATH. And then bonus points, if someone's a member of WPATH and they have achieved the status of a certified provider, which means that they've had documented hours of training, continuing education, clinical contact, and have taken and passed an exam through WPATH and have been certified as top-notch. So that's on your wish list for your therapist. But on a personal level, not just credentials, but what do you really want from a good gender therapist? They should be accepting. They should be nurturing. And by that, I mean they need to be able to both express concern about what your kid's going through and what you're going through, and kind of be able to walk that line between the two. And express concern, and you should all be able to feel it. They shouldn't dismiss or express negative attitudes about gender nonconforming behavior. They should, validate your concerns, but not dismiss or be critical of them. They should help educate you. As I said, you don't want to be educating them. They shouldn't impose a binary view of gender. They should be open to the idea of gender fluidity, and they should be comfortable dealing with the uncertainty that you're all experiencing around what does this mean, where are we going with this, what's going to happen. And then, as I said, they should be able to give you resources if you need referral out. Managing that uncertainty and the anxiety is really the important piece, because that really is when your kid comes out, that's what you're swimming in. And parents often want to know, what's going to happen? What's this mean? Where are we going? And a therapist should be able to, in a confident, comfortable way, say, I don't know. And to be able to still hold you in a safe place emotionally while we find out what's going to happen. You should also feel supported in the fact that you may have to be making difficult decisions, whether it's a decision about using a preferred name, decision about a hormonal intervention, decision about disclosure. Therapists should be understanding and caring and acknowledge that those are difficult decisions, and they should be able to support you in that, and also offer some guidance in terms of different ideas of some people write letters, or, can I help in some way? Can I go to the school and talk to them? So basically, therapists should have a lot of experience and background information that they can share with you, not to make the decisions for you, but to guide you. They should also be willing to stick with you for the long haul. Doesn't mean your kid's going to have to be in weekly therapy for the rest of their life, but they should be a touchstone for you that you can come back to again and again. Okay, now we're dealing with dating. Tell us about that. They should really strive to maintain a relationship with you like a family doctor does. I think some of the reason that parents don't bring their kids to therapy when they come out as trans is because in general, people have a stigma about mental health and therapy in general. Misconceptions about that we're mind readers, or that we're critical, or that we're going to blame the mother, or, that we're going to psychoanalyze you. And so I think there's a lot of fear and misunderstanding about therapy. I think on the other hand, for the accepting parents out there, there's oftentimes a feeling of, well, I'm not going to take my kid to therapy because I don't think there's anything wrong with them. Their being trans is not a mental health problem. And to that, I would say, I agree. That's not why I think they need to be here. But it's those other issues that I've already discussed. So therapy is there to help reduce distress for the kid and for the family. It's not there to try to change anyone's gender identity. We know that reparative therapy is damaging. It doesn't work. There's no place for it. It's unethical. It should be illegal everywhere. Other issues will get discussed in therapy, as I said, educational issues. I and other therapists want to treat the whole person, not just the gender piece. How are you functioning in school? How are your grades? How are your social relationships? And address the strengths and weaknesses within a family. One of the questions that came up was, how do we remove the family stigma around going to therapy? It is tough. I think being able to see a therapist as a guide rather than a critic, going back to my comment about the uncertainty, and you want a therapist who will acknowledge and be with you in the, I don't know your kid like your kid knows your kid. I don't know your kid like you know your kid. I think you have to find a therapist that feels human like that. There is stigma, I know, and especially in certain cultural groups or religious groups, there's even greater stigma. I like to think of my role as a therapist, as a gender therapist, as kind of akin to like a travel agent. I have a lot of information. I know a lot of resources. I have a lot of recommendations, maybe, but it's your vacation. It's your trip. You decide the duration. You decide how much you want to spend. You decide whether you want it to be rural. You decide. So a therapist should be like that. A guide, a helpful resource that you find useful. I hope that answers the question. In terms of another question that came up is, what age do you think it's appropriate for a trans child to start therapy? I think any age, really, with the right therapist. If it's a young child, I would suggest making sure, adding to that wish list, finding a therapist that works with young children that does play therapy. There are plenty of ways to work with kids that doesn't require that they sit on a couch for 45 minutes and have an intellectual conversation. But a lot can get expressed in play therapy and working with, toys and Legos and drawing, and it may not be direct dialogue with the kid about the gender of that stuffed animal. There can still be a lot of productive work that gets done around anxieties or fears or feeling isolated that can get worked out in play therapy. So I think even young children, 3 and up, I think can benefit from therapy. They themselves may not be old enough and able enough to articulate what it is they are struggling with, but a well-trained therapist will be able to glean that from what's being expressed through play and other modes of expression. So I don't think there's an age limit, but you want to find a therapist who has experience working with whatever that particular age or group of children is. Likewise, if it's a teen, you want someone who sees teens and has that experience and can connect on that level with that age group. Treatment will probably get discussed in therapy with your trans youth, especially as they approach adolescent or if they are adolescent. How that gets brought up and when that gets brought up is up to each individual therapist. I tend to take a quieter approach. I think it's very interesting to see when the kid brings it up, when and how often and with what degree of passion. But you want a gender therapist that knows about different treatment options and has factual information, did not just go read it online somewhere, which is probably what your kid did, but actually knows the truth and the details and the misconceptions about whatever intervention your kid is considering. Again, whether it's social transition or something more medically involved. One of the other issues that may get discussed in therapy, especially if a teen is contemplating or thinking about some sort of hormonal intervention, is fertility issues. And you need to have a gender therapist that knows that that's a very important discussion that needs to happen. There's a real big push in WPATH to make sure that we address that with people. That's a big decision to make, especially at such a young age. So I think I mentioned earlier the internalizing disorders of anxiety and depression. And I said, and also maybe PTSD. And I want to say a little bit more about that because I really do think that there is that quality to the experience of coming out as trans, both for the youth and for the parents. This is, it meets criteria. It's we can consider it an unusual and unexpected event that somewhat traumatic, that you feel very isolated around, that you maybe don't have a lot of support. So I think that families need to get some mental health support around that. And I think both a gender therapist and a support group like Stand With Trans offers is a good place and a good way to do that. The experience is traumatic for families. There's a lot of discussion and debate about whether or not or to what extent the process of dealing with a kid coming out also touches upon grief. Some parents really do identify with feeling like they are grieving a loss. Others do not. And you need to find a therapist who kind of knows that whatever it is your experience of it is valid, that they're not going to try to force you to not experience it as grief or not force you to feel the grief if you're not. So finding a good fit is very important in that regards. We have another question. Any advice for a 14-year-old trans girl who's experiencing quarantine dysphoria? In this particular question, she's 100% transitioned socially and is on cross-sex hormones. She has to wait for surgery, but staying at home gives her too much time to think about how much she hates her body. Listen, this quarantine has been difficult for everyone. And then more difficult for certain people who, yes, have too much time to think about whatever it is they're also dealing with on a day-to-day basis. So I can understand that would be a problem. Quarantine dysphoria, social support, find a way to get social support is important. I know that for youth, a 14-year-old, if you think about it, they're with their peers, typically with their peers 6 hours a day, 5 days a week, at least at school. And then they come home and they get on Snapchat or TikTok and they're still with their peers. So for them to be at home, not with peers, is really rough. And I know a lot of parents feel like, get out of your room. What are you doing in there? But you need to let your kids be on social media with their peers doing whatever. So I would urge, in this particular instance, try to increase the social support with friends, with perhaps the support of the Stand With Trans groups. Maybe setting aside worry time, as I like to call it, and set, and putting a limit if she has the internal resilience to do it, to say, listen, I'm gonna allow myself to think about, my body dysphoria and how hard it is, but only between these hours. And then I can't do it. I can't go there. There's no such thing as preventative worry. It doesn't help. It only gets me upset. Find a distraction of some sort. If not peers and social interaction, then, some sort of project, some sort of creative endeavor, exercise, or maybe redirecting the concern about how much she hates her body into, redoubling efforts to treat your body as well as you can during this time. Make sure you're eating well, make sure you're getting exercise, take good care of your skin, love your body as best you can, give yourself a manicure if that's what makes you feel good. A haircut would make me feel really good at this point, but that's not an option. But try to, redirect that self-hatred into, well, what can I do? And know that you aren't alone, that, as I said, we are all struggling with this quarantine dysphoria. I wonder if there's any other questions at this point, or Roz, if you have anything. Oh, I was going to talk about how do you find resources, because as I said, the first time we attempted this, so you didn't hear it, but one of the blessings that has come from this quarantine, if you will, is that Stand With Trans has gone tele and video, and in that way has increased their reach. They're no longer limited geographically to, we have a support group in your community, which is great. It's great that opens it up. There may be people watching or listening who are in, rural, wherever, Alabama, I don't know. But how do you find resources if they're not right in your neighborhood? The internet can be a great thing. Stand With Trans would be a good place to look for resources, because if Roz doesn't know, she will find out. She will contact me. She will contact other therapists she knows. She will contact other connections. We will then contact people we know, and she can be a great resource. The organization can be a great resource in finding connections for you wherever you are. But beyond that, the internet can be helpful. So if you enter in the search bar, transgender youth, and then put in your city name, something may come up. Or if you're in a very small city, you could put the next largest city name, transgender youth, Indianapolis, even if it's 120 miles away. I mentioned WPATH earlier. WPATH has a directory of service providers. You could search that. I know that oftentimes Psychology Today listings will come up with therapists that say they treat transgender youth or transgender individuals. You want to verify that. I have participated in Psychology Today listings before too, and basically you check the form to say, yes, I do this, and that's all the verification that happens. So be cautious of that. I mean, it's kind of like the Yellow Pages. You don't know what screening has gone on. But if you have others in the community who you think or know would be supportive or knowledgeable, they can be a great resource. If you don't have transgender support in your community, but there is a PFLAG group, which is often now doing transgender support, that would be a great resource. If you're place of worship has LGBT-friendly groups they may know. If nothing comes up when you search transgender youth in your city name, put in LGBT in your city name and see what comes up. And oftentimes people who work with sexual minorities will also have some knowledge or some resources for you in terms of transgender issues as well. There's a question, what about adolescents in therapy with or without parents? Are you obligated to share with parents? Yeah, good question. Youth are still keepers of the privilege is the term we use in psychology, meaning privileged information. Even though they are a minor, they have the right of confidentiality in therapy. There are 3 exceptions, basically. If they tell me they're going to kill themselves, and I believe that they have a plan and this is an intention, this is not a passing thought, I will break confidentiality. I must by law, and I will break confidentiality and inform parents, police, school, whoever I need to make sure that people stay safe. Likewise, danger to self. And by that, I mean suicide. So again, if there's an expression of a plan and an intention and a desire to kill yourself, I must and I will, by law, do whatever I can to make sure that that does not occur. I make a distinction, as do most therapists, between self-harm and suicide. As we know, some youth do cut or self-harm. Oftentimes their intention is not to kill themselves. It's for other reasons. I am not obligated to tell the parents about self-harm, but I will do my darndest, and I think most therapists would, to try to get the kid to talk about it with their parents, to disclose that, and to be reassured that it's being addressed in therapy. So danger to self, danger to others. And then the third exception to confidentiality is physical or sexual abuse. If your youth reports physical or sexual abuse, either current or past, we're obligated to report that. And the wording is even suspected. It's not my job to investigate. I don't, but if I have reason to believe that this could have been going on, I must report that to CPS, and they will investigate to keep your youth and other youth safe and protected. So danger to self, danger to others, physical or sexual abuse, those are the exceptions to confidentiality for all people that come to therapy, adults and minors. And then the fourth exception is if you initiate or are part of a legal proceeding and you bring your mental health into that in some way as a topic, you're opening a can of worms. And if records get subpoenaed, then confidentiality will legally be broken by your own undoing. But otherwise, it's just those 3 cases. So in terms of what I'm obligated to share with parents, as I said, not obligated to share about cutting or self-harm, but I will work, and I think most therapists would work to improve coping skills and work to improve communication in the family and work to get the youth to disclose that themselves to the parents. It's better you tell your parents than they find out. So that would be, as I said, not a reason to break confidentiality, but a very concerning topic that would have to get discussed in therapy. The question arises, if a parent notices cutting, is this a reason to start therapy? How should that be managed? Yes. Cutting is an attempt to solve some other problem. relief from emotional distress. There's a certain degree of self-soothing that goes on with cutting, but there's something going on that's leading to the cutting as an attempt to resolve some other problem. So yes, if your youth is cutting, it's a good reason to start therapy. How should it be managed? I would come from the place of saying, this is an opportunity to help you figure out what exactly is not right in your life, and if there are some better ways to deal with that. Please don't bring your kid to therapy and frame me or a therapist as the jailer or the punishment for cut. You were cutting, and so now you have to go to therapy. That's not ideal. I would try to present it as, obviously you've got some things going on that you are not feeling all that capable to deal with on your own. I'm not equipped to help you, so let's get some assistance. Here's someone who can possibly help in these situations. So I think that, that clearly is a sign of a reason to take a kid to therapy, whether they're dealing with issues around gender or not. Any type of acting out behavior, self-harm, drug use, falling grades, those are red flags that something's not right and may need to be addressed. So therapy would be a good place to start with that. And then an individual therapist can assess whether or not, or to what extent, that should be individual therapy for the youth or family therapy or a combination of the two, whatever the issue is that has led to the cutting. Cutting can be very addictive. So the sooner you intervene, the better, which I think is a general rule of thumb for a lot of issues in therapy. The sooner you can get on top of it, whether it's anxiety or drug use, the better your outcomes. So don't let the stigma about therapy get in the way of that. In terms of how else to manage getting your kid into therapy if they're cutting or if you just have other concerns, I've mentioned before the importance for there to be a fit between the therapist and the youth or the family. So again, I would frame it as, let's give this a try. Let's give it 6 weeks and see. And if it's not a good fit, we'll find something else. I think it's important, and a good therapist will also come from the same place of, if it's not a good fit, let me refer you out to something that might be better and meet your needs. In terms of resources for parents to deal with their kids cutting, I don't know of any offhand. Talking to a therapist who has dealt with this would probably be helpful. I know that there are some books about the topic. I can get back to Roz later in terms of some specific titles, if that would be helpful. Again, I think some education around it can be the most basic of help, right? So understanding that there is a difference between suicide and cutting, that it doesn't mean your child wants to kill themselves, though they may, but it means they are having trouble with their internal emotions and internal states, and they feel a need to get it out somehow. And for some people, cutting is the way to do that. So I think having that piece of education, and as I said, knowing also that it can be addictive and that it really needs to get addressed sooner rather than later is good. Some kids will try it and it doesn't work for them in the way they thought, and it's a one and done. They aren't going to do it again. But others, it becomes a real like I said, source of relief. I know for trans kids with a lot of body hatred, the cutting can often be focused on their anatomy and aspects of their body that are gender specific. So cutting on breast or chest area, or other parts of the body that they deem to be gendered for them, cutting on hips. So you may not even see the cutting. It might not be the what you imagine, typical if there is cutting on a wrist or something like that. It may be in a body area that you don't have access to. But if you do notice it, please do something about it. And you also have to consider that if you do notice it, they're letting you notice it, and it is a cry for help. So signs to watch out for in terms of whether or not your kid is cutting would be well, if they're wearing long sleeves and long pants, and whether that wouldn't necessarily deem long sleeves and long pants, I'd be suspicious or concerned about what's up with that. If you're finding bottles of hydrogen peroxide in their room, or you're going through a lot of Band-Aids at the house, there'd be some signs that might not be obvious, but those would certainly be ones that I would kind of inquire further about. But certainly the long sleeves and pants when they might otherwise be wearing shorts or skirts. They may lie to you if you inquire the first time, oh, the cat scratched me, or oh, I cut myself shaving, or I would just express concern. And like I said, think about getting some mental health help for that. We've got maybe, I think Roz, are we done at 2:30? Do we have just like 7 minutes left? Okay, so any last minute questions or comments about therapy for your kid and your family when gender has become an issue? I'd be glad to address those. Let me address some things I hear, and I don't know if Roz hears these in the parent support groups, but I talked a little bit earlier about grief and the grieving process, and that some parents do experience their kid coming out as trans as a loss. This isn't the kid I thought it was. I think whether you go through the whole grief process or not, for many parents, their initial reaction is one of denial. This isn't true. It can't be true. I don't want it to be true. And these days, I think a lot of parents will jump to it's social contagion, it's trendy. No one identifies as trans just because it's trendy. There's something about that resonates with your youth. And I'm gonna, leave it at that and say, this is not just your kid's gonna, be popular if they come out as trans. There's something about that identity that resonates with them, and it's worth pursuing and finding out more about it. There's a question of, what if the parent is unsure? Do you evaluate the child and determine if they're trans? It's a tricky question. I can diagnose gender dysphoria based on the criteria. Whether or not your kid is trans, whether or not anyone is trans is not my judgment to make. My role, as I see it, is to help them figure out what their gender identity is, and maybe more importantly, and what they need to do about it. I see my role and the role of a gender therapist as helping you deal with the uncertainty and the distress of maybe of not knowing what this means or how true it is. I think erring on the side of acceptance and believing and support is the safest bet, though. You know, you don't want to be wrong and reject the idea, because the outcomes are horrible. We know that. The rates of suicide among trans youth that aren't accepted is just staggering. And having any one adult in your life that accepts your trans identity can be a lifesaver. So I think, you know, that could be the therapist who says, you know, all right, if you say you're trans, let's go from there. I don't think, I mean, I take a worldview approach of, you know, none of us knows what the future is going to bring. I don't believe that everyone who says they're cisgender is necessarily going to stay with that identity. I don't know what your kid's identity is going to be in the future, but what's the harm in if they say they're trans? Let's roll with this. Let's work with this. Let's explore it. Let's let them kind of sit with that and express it and experience it and see if it's a fit. And you view this as in the long haul. I know that, you know, kids go through phases and try things out, and they usually are just that, phases, and they try things out. Something persists for 6 months, a year, that's not necessarily a phase. So in terms of, do I determine if they're trans? No. I personally, as a gender therapist, wouldn't put myself in that role of determining if someone is trans or determining if someone is heterosexual. Or I take people at their word. And my understanding and interest is in, you know, tell me more about how you got there and what that means to you. And again, clarification, articulation, you know, the term of these days is unpacking. Let's take a look at that and what does it mean, and what do you need to do about it, and how is this working in your life? And I think exploring that will help the kid, the child, the teen figure out what identity they are most comfortable with. I hope that answers that question in that regard.
This was amazing. I always learned so much. So I watch attentively. And for those, we had several people who joined kind of at the end. Want them to know that this does live on Facebook. So Facebook will render the video and then it's there for you to watch at your convenience. And do you want to share your phone number if anybody wants to call your office?
Sure, my virtual office.
Your virtual office, yes.
Yeah, luckily the phone travels. Sure, my physical office when I am there is in Farmington Hills. My phone number is area code 248-553-9053. I currently am seeing patients through telehealth. It's not ideal. I don't like it. It's draining. It's not the ideal way to start therapy and treatment with someone. But, you know, if you're interested in making contact, feel free to call and let's talk about, you know, what can help at this time in your life.
Great. Thank you so much. This has been wonderful. Have a great weekend. And thank you to everyone out there in Facebook Live land who was watching and commenting. And again, the video will be up there so you can go back and watch. And I think you can probably still add some comments or questions and we'll try to catch those. So Dr. Corretto, thank you so much.
You're welcome.
We'll talk to you soon.
All right, bye-bye.